for folks that weren't able to be here. So we're going to start with introductions. I will call names if that's okay, so we don't talk over top of each other. So we will start with Chris.
Good afternoon, everyone. I'm Chris Lewis. I'm with the ETSU Addiction Science Center.
Thanks, Chris. Joss?
Oh, I wasn't muted. Hi, I'm Jocelyn. I am the Assistant Project Coordinator for CCDP.
Thank you. Elizabeth?
Hi, I'm a certified peer recovery support specialist at ETSU's Addictive Science Center.
Thanks for being here. John Paul?
Hi, I'm John Paul Linke. I'm the project coordinator with Sullivan County Overdose Response Team through Sullivan County Anti-Drug Coalition.
Thank you. Dr. Tony DeLucia?
Hi, Tony DeLucia, professor in the Department of Surgery at Quillen College of Medicine over in JC.
Thank you. Angela Hegeman?
Hi, everyone. I'm Angela Hegeman, the Operations Director for the ETSU Addiction Science Center. Super excited to have Elizabeth here with us now full-time. It's her first day. She'll be working with ETSU Family Medicine on the SFIRT project and also with a lot of other things that the Addiction Science Center has going on. And I also serve as the treasurer for Carter County Drug Prevention.
Thank you. Ashley and baby Arlo.
Hi, this is Ashley. I am at the Elizabeth and Carter County Public Library, and I am the chair of the steering committee for CCDP. And this is Arlo, my brand new 2-week-old grandson, and we're coming to you from Key West today.
We need to see your video.
Yes, let me turn it on.
Look at him. Oh my goodness. Sweet baby.
Yes.
Okay. Apologies for having to follow the baby, but Dolly, want to go next?
Hi, I'm Dolly Reeves, project coordinator for Carter County Drug Prevention.
Thank you. Brianna.
Hey, I'm Brianna. I'm Director of Juvenile Court for Carter County.
Thank you. Emma.
Hi, I'm Emma Carpenter, sophomore at Home Life Academy, president of CCDP Youth Coalition, and president of CCDP Teach SAD, and member of SLC.
Thanks, Em. Lupe.
So there's actually 3 of us here.
Hi.
So it's Tammy Wilson, the program manager for Tennessee Voices Survivor Connection, and I'm sure she's got other credentials. Sue Gooden, the family support specialist for Survivor Connection, and me, the care coordinator.
Awesome. Thanks for being here. We're going to call you Lupe and company for the rest of the meeting. All right, Jason Abernathy. You're muted, friend.
That's because I like to talk to myself. I'm Jason Abernathy. I'm the Region 1 Lifeline Peer Project Coordinator.
Thank you. Jane Harper.
Hi, good afternoon. This is Jane Harper. I'm with the Tennessee Department of Health.
Thank you. Jessica from CHIPS.
Hi, I'm Jessica. I am the community educator for CHIPS, which is a family violence shelter in our.
Thank you. Kim Crowder. Okay, we'll come back to Kim Crowder. Mary Shell.
Hi, I am Mary Shell. I am the family engagement coach for Tennessee Child Care Resource and Referral for the Upper East area.
Thank you. Molly Colley.
Hi, everybody. I'm sorry if it sounds like I'm in a wind tunnel. I'm driving from point A to point B. My name is Molly Colley. I'm the Northeast Regional Director for Tennessee Suicide Prevention Network.
Thank you. Nicole.
I'm Nicole Moore, the Public Relations Coordinator for Elizabethton City Schools.
Rachel.
Hey, I'm Rachel Roden, Coordinator for the 1st District Felony Recovery Court.
Sam. We'll come back to Sam. Shannon.
Hello, my name is Shannon Payne. I'm the Peak Mentorship Program Coordinator for the City of Elizabeth.
Thank you. Sonia.
Hello, I'm Sonia Miller with Carter County Schools.
Hey, Sonia. Sherry.
Hi, I'm Sherry Barnett. I am the Regional Overdose Prevention Specialist for Region 1 in Tennessee.
Thank you. Terry.
Hi, I'm Terry Condup. I'm the Northeast Regional Director for Tennessee Reconnect.
Thank you. Vicki.
Hi, everybody. I'm Vicki Clark. I'm the UT Extension Family and Consumer Science Agent here in Carter County.
Thank you. And let's see who I missed. Alexis.
Hi, I'm Lexi Gillert with Nurse Family Partnership, and I'm a nurse home visitor.
Thank you. Okay, Kim Crowder, are you with us? Or Sam Loveday? All right, so we will go ahead and get started. Thanks everybody for being here. Super excited to have all of you all again with us this month. Our presenter this month is John Paul Linke from Sullivan County Anti-Drug Coalition. I'm excited to have him share a little bit more with you all about his program and some of the awesome things that SCAD is doing. So I will turn it over to John Paul.
Thank you. All right, I'm as introduced. Jillian, thank you for having me. I appreciate you reaching out and asking me just to talk about one of the projects that the Sullivan County Anti-Coalition is doing. For the coming up on 2 years here, the Sullivan County Overdose Response Team has been working to reduce overdoses and overdose deaths in Sullivan County. We are funded by the Tennessee Department of Mental Health and Substance Abuse by a grant, and hopefully our new grant will come in. What we are is a team of a family advocate, 2 certified peer support specialists, and a case manager, and myself, the project manager. The way the majority of what happens with us is we receive referrals or notification of a non-fatal and even sometimes fatal overdoses by either Sullivan County Sheriff's Office, Bluff City Police, Bristol, Tennessee Police, Kingsport Police, or by the TBI. We get copies of the reports and we get information. What we do is we try to deploy the team within 24 to 48 hours of receiving notification. And what we do is we actually go right out to the individual's home to meet with them. Law enforcement does go with us on the first visit. Oftentimes, just with a few minutes into the visit, we are able to tell the officer, hey, you know, you can go on to the next stop, because there's a little bit of shock and awe when we come in, but we're there to be non-judgmental, offer them services, assess the situation. If they want to sign up with us, we're a free service. We will help guide them through recovery for at least a year. And of course, the state, has us do all kinds of documentation. The family advocate will oftentimes, if there's family members present, will kind of get them off to the side. We'll migrate them into a kitchen or a living room and talk with them about issues they're having, because a lot of times they're just as sick as the individual who has OD'd. This allows the certified peer support specialist to engage with the overdose victim and talk to them and share their own experience, strength, and hope, and talk with them about recovery options, be it medication-assisted treatment, detox, rehab, sober living, 12 and 12, faith-based initiatives, just a little bit of everything. We're not there to judge them. Even if they don't sign up with our program, we will often say, hey, can we still stay in touch with you? Can we call you? Can we text you? And most of the time they say yes. And so we continue to reach out to them. And a lot of times it's not on that first visit. They decide, hey, I want to try something different. So there's a lot of seed planting there. Also, we will train family members and also the overdose victim on Narcan and leave them Narcan. Oftentimes we'll provide them with a medication lockbox for the family members. We work on that stigma reduction, the harm reduction, and ultimately getting them into some sort of treatment. Most of the time we find that they're indigent. So what we do is we try to find recovery programs that have grant beds available. Turning Point has been a tremendous help to us, whether they're indigent or have insurance. But a lot of times, particularly during those summer months, it seems that a lot of, grant monies are running out, and we have had to, transport people to Nashville and Chattanooga and Knoxville. But we won't give up. We're going to try to find them a place. So we have grown, and let me just pull up some more recent numbers, because we actually try to keep a live update. So far in 2020, we've received 21 notifications of fatal overdoses. But our total referrals, that includes those overdose deaths, have been 181. Majority of these all coming from law enforcement. We do get some self-referrals, and we'll get referrals from Shades of Grace or the Recovery Navigators or Branch House. Our referral process is very simple. If somebody wants to self-refer, they can call us at 423-408-8134, or we have a very simple self-referral, takes maybe 45 seconds, at sullivanod.org. We get instant notification, and I immediately let the team know so we can plan on getting the team out to meet somebody, strike while the iron's hot. I didn't want to take a whole bunch of time because I knew you had a lot of things going on, but what questions might you have for me that I can try to answer for you?
How do you get the lockboxes out to families? Do you hold events? Do you give them to public places? Or do you just give them to families that you find have people who overdose there?
Well, the coalition itself does have an initiative and we have lock boxes. We have these metal lock boxes. We have these combination lock boxes, and they also have medication disposal items to deactivate meds and things, and also will sponsor, the take back events. But if somebody is needing a box, they just simply need to call us or the coalition, and we'll manage, to get them one.
What other questions do y'all have?
Hey, John.
Yes,
What y'all's call volume been like here lately? Is it gone up?
There has been a increase in overdoses the last few months, pretty much since COVID became, whether that's due to isolation or I don't know if it's because people got stimulus money, but there has been a rise in overdoses, and we've seen probably over half our notifications are heroin or heroin fentanyl mixed. It's out there, and we'll even talk with the TBI because we'll see trends in areas, which usually they're already aware of, but they're a good partner, and the Sullivan County Sheriff's Office and DA's office, they're not after us to get information, from the clients and everything. If somebody wants to say so-and-so's dealing and doing this, we have Chuck Kimbrell's cards with the TBI, and we can say, hey, maybe you want to call this guy. Well, we always leave one of those cards with them too. We're there to help people get clean, sober. I don't want to use those terms, just towards solid recovery. The beard looks great, Jason.
Thanks, JP. I appreciate it. Love you.
Any other questions?
I said it was going to be a brief.
This is Tony DeLucia.
Yes.
I know there are other folks from ETSU on the phone. I was just wondering, are you working with ETSU at all?
We have been to some of their meetings. I know Sherry's worked close with different aspects of the ETSU addiction programs. But that's about the majority of our involvement right now.
It might be interesting to try and coordinate a little bit more. I don't know, Jillian, if you can help me get some of the contact information, or you can send my contact information. I had a wonderful intern this summer, and maybe getting one again coming summer, even though COVID makes it kind of difficult. Tracking numbers is one thing, but actually getting some more programmatic things might be very helpful as well.
Absolutely. Happy to connect y'all. Anything else for John Paul? All right, thank you so much for being here and sharing with us. John Paul has put his contact information in the chat box if anybody wants to reach out to him or needs more info. Next, I'm going to throw it to Emma to share a little bit about Youth Coalition and SAD Club. Just to brag on her for a second, they had their first virtual meeting today, and Emma and her team did an amazing job at facilitating that meeting completely on their own. So super duper proud of them today, and we'll let Emma update you on their progress.
It impressed me, but it kind of saddened me. I just asked them what issues they saw, and I got like this huge list of just things they see, like racism, youth vaping, substance abuse, opioids, human trafficking, ACEs, tobacco, alcohol, bullying, and litter. These topics actually came from kids who aren't even in youth coalitions, and yet they still see it. Like, you would think that since we're homeschooled, we're supposed to be sheltered and that we wouldn't see this stuff, and yet we still do. So I thought it was very impressive to see, and then I asked them for some ideas they might have. Of course, because they haven't been in a coalition before, this is where they kind of need a little help, but they knew that we had to make the world aware of these issues. So I'm very impressed with them. As for SLC, they have partnered with MTV as they are premiering 16 and Recovering. I don't know if anyone watched that last night, but it was very good. I watched an episode of it. It was very sad to see teens who were suffering from drug use. And I will be meeting with them tomorrow for another group session, so I'll have more to talk about then. And we're also coming up with Sticker Shock. I don't know if Jillian wants me to talk about that. You don't want me? Okay. Sticker Shock is where we will be going into stores. McKenna is personally connected to one store manager, so we'll be going there first. And we're going to put stickers reminding adults that it is illegal to give minors alcohol, because we have been going to stores and seeing it happen. And that it's also illegal for minors to buy alcohol themselves, which has also happened. So we're going to go and put stickers up, hopefully just showing people the effect it can have.
Thanks, Em. Okay. I'm going to ask Dolly to share DFC updates.
All right. So we're still working on the community needs assessment, which as last time we talked about the fact that we were doing the provider and agency survey. We have also recently conducted youth focus groups. So we have conducted youth focus group with 4th and 5th graders, middle schoolers, and high schoolers. The next step is we have distributed a adult survey as well, and we are asking folks to give us their feedback on that, so that we can just go ahead and have all the bases covered in terms of getting some feedback from the community before we start engaging in other areas of the community needs assessment. And I am going to put actually the adult survey inside the chat box. It's different than the provider survey, so I would still please encourage you, even if you filled out that one, please fill out this one as well and pass it out to any adult you know who's living in Carter County. Doesn't matter if they have kids or don't have kids, or if you filled out the provider survey either. So so I'll be putting that in the chat box and looking forward to getting some responses in that.
Thanks, Dolly. So this is an area that I think Dolly struggled to get folks to answer these surveys. And this is just a general population survey. So anybody can take this one. I think most of you all took our provider survey, or if you haven't done that, please shoot Dolly a message and let her know so you can take it. And so this is different from that. And I just wanted to make that clear that this is just you as a community member. How do you feel about certain things? I'm really excited about this needs assessment. We are working with Dr. Mathis and some students who are just doing some really innovative, I think, things that will be extremely helpful to sort of painting a picture of where we are and what we need. I am personally super excited because we're looking at evaluating the Youth Coalition efforts. And that's something that I think we've struggled to do in the past. And so I'm just really excited about the partnership that Dolly has with Dr. Mathis and ETSU students, and the results that we'll get from all of these awesome surveys. So please fill those out.
Yeah, and if you have any ideas on how to distribute these surveys to get more responses in the community, I'm all ears.
Thank you, Dolly. I think Jane is still with us. I may ask her to comment on this too. At our last meeting, we talked about the potential for combining some community meetings, collaborating to, I know for a lot of us, we are attending our community advisory board, and we're attending health council, and we're attending the CCDP meeting, and seeing a lot of the same faces, seeing a lot of the same speakers, and spending a lot of time being at all of those places. And so Jane has done a really great job at creating some instruments to collect data from you all about how you feel about combining the pros and cons and all of the thoughts you may have. So I'm going to put the link to her survey in the chat box right now. If you will please share feedback, positive or negative. I think in my opinion, our hardest piece of this is going to be finding a meeting time that works for everyone. And so that's in there too, so we can kind of look at availability, as well as just really get your feelings on if this is a good thing or something that we don't want to do. And I'll let Jane add anything she wants to add or share how feedback has been so far, if you don't mind.
Hi, thanks a lot. Sure, we've gotten, as of yesterday, we had 18 surveys from folks. They're going out to the email lists for Carter County Drug Prevention, the Community Action Board, or CAB, and the Health Council. We're collecting the surveys until the close of business on Friday the 11th. And so far, we've gotten some pretty positive feedback in terms of, yes, please combine, but some really thoughtful comments and questions about things that we should take into account if we do decide to move forward. So please keep all this information and questions and comments coming. If you haven't already done it, we really do want to hear from you. And if this is the best move for all of these groups, we want to do it well, we want to do it right and serve everybody. And if you have any questions offline, please feel free to reach out to me. And just thank you for your time in doing this and considering it.
Thank you, Jane. Does anybody have any thoughts about this that they are just dying to discuss right now that maybe they don't feel like they can capture on the survey, or just want to talk about in person as a whole group?
Yeah, I know you and I have talked about this before, and I mean, there is obviously the concern that a combined meeting will dilute the mission of any of the groups because it's combined. So I think as long as there's a plan to continue, you know, semi-annual CCDP specific meetings, or have the work groups, you know, some sort of task work groups that are still active, that are CCDP focused, it makes sense to combine them. But that wasn't really on the survey, like options for how to maintain the mission of each group. And so I think combining makes total sense, as long as there's an intentional way that each group maintains its identity through other group meetings or activities and things like that.
Thank you. Anybody else have thoughts? Okay, well, if you do, please let me know. Please fill out the survey. I absolutely am just grateful for Jane and sort of her leadership over this, in bringing people together and having us all think through what this might look like, as well as just being mindful of the community partners that we have and the amount of time and energy it takes to attend these 3 meetings, and what something, you know, what benefits there may be to combining, while also holding in mind any cons that there may be as well. So thank you, Jane, for doing that. I wanted to let you all share what you have going on. If anybody has updates or activities or things going on, please share those with us.
Hey, Jillian, it's Jason. Did Jennifer sent out an email recently? We've got a new grant coming up, the COAP grant, COAP grant here, and we're going to be looking to hire 2 certified peer recovery specialists for 2 different positions. One's going to kind of be a liaison in the court system down Washington County for folks coming out of incarceration, looking to get into recovery, whether it be housing, treatment, what have you, jobs. And we're also going to have a position for like a coordinator, you know, to as they come out of jail and they get into treatment, then once they come out of treatment, somebody to kind of help them get put into housing or some of the other support services. So I just wanted to bring that up again. Did you get that from her? And if so, could you pass that along? I think, you know, we've had talks back since the first of the year, and it finally cropped up that I think October 1 is going to be the start date on it. So it's kind of a quick turnaround process, but in the email, you know, she had, there were some instructions about where to send the documents so we can give those a look and probably do some interviews later on in the month. Did you get that?
I think so. I'll make sure. If not, I'll yell at you. But I will send that out to everybody after our meeting. Thank you, Francis.
All right. Thank you, ma'am.
What else y'all got going on?
I have a thing.
Awesome.
So we heard from, and some of you may have also been a part of these conversations, the Downtown Johnson City Homeless Task Force. I realize that's not maybe the best words to use, most affirming words, but that's the name of the task force. They have been talking about a lot of issues related to folks who are housing insecure, a lot of the, you know, buildings being purchased in downtown, but Muncie Memorial is a part of that group, and they've recently been seeing a much higher number of disposed used syringes. And a lot of folks, so there was I think there used to be porta-johns that were available to folks, and there were a lot of the syringes that would end up in the porta-john, but not out in the property. And those porta-johns are no longer available from what I understand. And so there are lots of used syringes and folks that don't have access to disposal and, you know, a bathroom. And so they've been trying to work on a plan to fix that. And in their minutes, it mentioned a partnership with ETSU Addiction Science Center as a possible solution, at least for the syringes. And as you know, our Addiction Science Center doesn't necessarily provide direct service in that way. So we reached out to STEP TN, but we know that STEP TN is our local syringe exchange program, really struggling financially. I don't know that they would have the capacity at this point to do much about that. And even if they did have funding, I don't know that they have a mobile unit. And so long story short, there aren't any easy answers to this yet, but our next working group meeting that group is meeting today, and 2 folks from our center attended the meeting. And then our next working group meeting of the Addiction Science Center is at 4 p.m. next Tuesday. And we're pretty much inviting anyone that has any ideas to attend that meeting to brainstorm for ways that we can help both STEP Tennessee. They're going to come in at 5 o'clock and present. And also, you know, what can we do? Are there temporary disposal boxes? I know in Unicoi County at the park, they have some safety disposal boxes. We do have to be sure that law enforcement are on board because what we've known in other communities is that if you put a disposal box, sometimes law enforcement target that area because it is illegal to have the paraphernalia. So we would need to have some agreements in place. It's not as simple as just putting a box up. But so we're going to talk about that. And I imagine that there's some folks in this meeting right now that would be offer some great feedback. So that's at 4 p.m. And I can send you get the link, I think, to the Addiction Science Center working group meetings. So just a heads up on that. We could use your help.
I will, when I email out everything else, I'll email out the info for that meeting as well. Making a note of that so I don't forget that I said I would do that. Okay, perfect. who else has stuff to share?
Otherwise, I don't know if somebody else is getting ready to talk, or if I can say something really quick.
Go for it. We'll go you and then Jill.
Okay, thank you. Sorry, couldn't see everybody. Just really quick, I was just thinking in another meeting that I was in, somebody shared this great resource. It's called safeathome.org. It's a service that allows people who are domestic violence victims or human trafficking victims to confidentially register or hide their physical address that they're living in, so so that folks can't find them. So this is helpful in this time for people who you may know that are afraid to register to vote because they don't want their address to be public. But anyways, I just want to kind of put it on your radar that there are people who are afraid to have their address public because of a previous traumatic situation they may have been in, and just to be mindful of that. And I will share the link on there so that if you know of anybody who may have barriers to getting services because they don't want to put down their address, that this is a service that they can use.
Holly, how exactly does that work? Because I know we work with a lot of domestic violence clients. So what does it give them, like an alternate address or something? I'm confused.
Yeah, so it gives them an alternative physical address to put down, especially if they're registering the vote. It will give them a different one to use so that they can still register within their precinct as well. So yeah.
Okay, cool, thanks.
You know, I always have something. Sorry, I'm a little late, but I'm Jill Stott. I'm with Tennessee Commission on Children and Youth. This is my sidekick, Molly. We have several trainings happening. One is tomorrow, and that is cultural engagement with Pastor Edward Palmer. He did a training for us a couple weeks ago, and just an absolutely rock star presenter, and that was on implicit bias. And this is part of a 3-part series. So tomorrow at 1 Eastern time, if you are not registered and you're interested, please let me know. I'll stick my email in the chat box so I can get you login information. We still have a little bit of space. But all of our trainings have CEUs, and this one has I think 3 CEUs if you attend. But and then the 3rd part of that series is coming up September the 16th, and that is I don't have the name of that one. It's a little bit different. It is Let's Talk Cultural and Linguistic Competency. And that is also going to be 1 to 3:30 p.m., 4:30 p.m., September the 16th. We have not sent registration out for that. That will go out probably tomorrow after our training. But if you are interested, please let me know if you're not on my distribution list. And then one other training I would like to mention that's coming up, and that's October the 9th. It's very specific, designed for law enforcement personnel, first responders, school resource officers, judges, juvenile court staff, and probation personnel. But it is with our dear friend Becky Haas, and it is Trauma-Informed Policing 2072, and I think that's a very specific training that they're required to have now, if I'm not mistaken. But it is, we are also offering the post certification for police officers. So I would just encourage you to email me if there's folks that you know, either that I can send this to, or if there's someone I can send it to you to get it in the right hands. We are going to offer the trauma-informed approach with Becky on October the 20th to the general public, but this one's very specific. So if you have folks in mind, please just shoot me an email or just say, send me that so I can get it into some folks' hands. So, and again, I mean, really, all of you all would be considered first responders, I would think so as well. So that's about all I have.
Thank you, Jill. I was going to also show you this. This appeared on my desk, so thank you, whoever put it on my desk. But this is Jill and I did a proclamation with the city and county mayors to make September Suicide Prevention Awareness Month. And so this is the county proclamation. And hopefully the city one will be coming along soon as well. So
thank you so much.
Yeah, and thanks whoever happened to lay it on my desk today also. I'm like, oh good, a proclamation. So, yes, so those are done. We're excited about that.
Thank you, Jillian.
Yes, thanks, Jill. Okay, who else has updates?
Can I go?
Yep, go for it.
All right, cool. Hey guys, my name's Shannon Payne. I'm the Peak Mentorship Program Coordinator for the City of Elizabethton. And we started something today that I'm just really, really excited about. It's a world tour. We got some more money from the Department of Human Services, and we extended it on out. We're going to extend this all the way till December. And we're doing a different theme each month. We went to Australia today. So the kids are coming up to the back of the library. They're picking up their passport, free lunch. And they enjoy their lunch at one of our parks. And also the Carter County Drug Prevention Coalition is involved in this. The public library is involved in this. The Bonnie and Kate Theater, and also the Peak Mentors. So they go get their lunch and they come back to the Bonnie and Kate at 1 o'clock, and we're viewing a different film each week. Today was Rescuers Down Under because the theme was Australia. Next week's Mary Poppins Returns with England, Rio for Brazil the next week, and this is rolling for 12 weeks, and I think we're booked completely for the next 6 to 7 weeks. Every ticket is already sold. Due to COVID-19 guidelines, we can only sell so many tickets. So we are packed up. People are showing up today. We gave away lunches to 24 adults and 52 kids, and there was 40 people that showed up for the movie. So to be the very first day, we was totally excited over that, and I thought the numbers were just outstanding for that to happen today. I'm making a match this evening at 6:30. We're getting ready to go back face to face. We're going to, of course, due to COVID-19 guidelines, face masks and temperature checks and all the things. Working on a partnership with Mahoney's with David Ramsey. That's pretty exciting for us. Whenever they get started on that, they're going to give us some guide and stuff, and take us spelunking and whatever kind of other activities they're going to give us, and they're not going to charge us anything. So we got some cool things going on over here at Peak Mentors. Got another match coming up here pretty soon. So we're rolling the program with 5 mentors and 5 mentees. So feel pretty good, even though we got this thing going on, but we're rolling over here at Peak Mentors. So thank you guys. And if anybody's, I just want to say, yes, it's free. Yes, lunch is free. It's free activity. The movie's free. Everything's free for the kids and adults that want to participate in the programs. So just want to thank these people that make this stuff happen, Jillian and Ashley, and it's just amazing all the cool ideas that come from these people, and I'm so happy to be a part of this. But thank you guys.
We're pretty happy to have you be part of it too. I am also super excited about this. Ashley and I get these wild ideas in our heads, and sometimes they turn out pretty cool, and this is one that I am excited about. We know that most of the schools around here are not meeting in person on Wednesdays, and so we felt like that was an opportunity to do some community collaboration, offer lunch to some kiddos, and and also provide those activities that, and Ashley can add more to this if she wants to, but we just wrapped up a series of something similar with Parks and Rec. And so on Mondays, Shannon has been handing out summer camp bags, just something that, again, I was so impressed by our youth coalition and these innovative ideas that they have. And so kids would pick up a bag on Monday. Maybe it was stress relief camp, and every day they would have a different activity. So in their bag, they would have a yoga mat, or they would have a Zen garden, or they would have these different things that to pull out each day of the week and do camp at home. And so we just felt like that was really successful, and summer ended, but COVID did not. And so we just wanted to keep doing something, something for the kids and for their families. And so Ashley has had a lot of grandparents raising grandchildren that have been just really appreciative and really desperate for activities, for things to do with their kiddos in this weird time that we're living in. And a lot of lower income families that aren't able to necessarily be with their kiddos all the time because they're working 1 or 2 or 3 jobs. And so we are really excited about doing this world tour. And we did Eventbrites so that we could sort of, Bonnie Kate wanted to be at half capacity, and so we did Eventbrite so that they could do that, but the tickets went really fast. And so 75 seats in Bonnie Kate filled up pretty quickly. And so Bonnie Kate is willing to do a second showing for us. I wanted to see today if the 75 people actually came before we added a second showing, but that is something that we can do, is add a second, at least, movie, and we can always up our numbers of food. We are super grateful for Department of Human Services and them just continuing to partner with the library and us and let us feed people. It's something that is so needed in our community, and we're just grateful to be able to meet that need. So super excited about that. Shannon does not give himself enough credit with our mentoring program, but I've been so impressed with the impact that our mentors are having on kiddos. The same thing along the lines with the world tour, just kids that really need interaction and really need safe, stable, nurturing relationships, and have been having that need met so often by mentors. I will also say he needs more mentors. We have been really, really grateful lately for referrals from all of you, getting kids from lots of different places. And so that is, that's wonderful. We're so happy to have those kiddos that are ready for a safe, stable, nurturing relationship. But we do need adult mentors to match them with. So if you're at all interested in meeting with a kiddo 1 day a week, about an hour a week is what we ask. We would love to have you and match you to really impact a kiddo's life. So that's my mentoring spiel there. So thank you, Shannon. I also wanted to share that our Youth Coalition did a presentation for the Department of Mental Health and Substance Abuse Services last week for all funded coalitions across the state. And they just were very, very, I think, just grateful and I think surprised in a lot of ways that they were so awesome. And so I wanted to just shout out to Emma and to Chloe and Claire and Kenna, and also say that presentation was recorded. And so if you as a coalition member ever want to brag on our awesome youth coalition and need a 20-minute presentation, we have it, and they did a really, really awesome job with it. The goal of the presentation was teaching others, other coalitions or other groups to engage youth, talking about how to start a youth coalition, talking about retaining youth in a coalition, and it was really, really good. They've gotten like job offers from Memphis to speak to their schools and all kinds of things. I haven't even told you that yet, Emma, but you're hired in some school in West Tennessee. So just really, really cool. And yes, I will share a link to that. And if it's ever helpful for you all, please know that we have that recorded, and it's super good. Anybody else have updates?
Yeah, this is Tony. I mentioned my intern, and I had one this past year, and she started in May, and I only had her for 6 weeks. We got a lot of work done on sort of a deep dive into data, and I had written up an abstract on what's called the deaths of despair, which are suicides, overdoses, and deaths due to a lot of overconsumption of alcohol, which is something that's really hitting white, middle-aged, more poorly educated members of the society, and it's causing a decrease in life expectancy throughout the United States, but it's been kind of picked up to be a little bit more specific in certain parts of the country. And Shannon O'Connor, who was a first-year medical student that I had, we looked at kind of trying to integrate that into some work that we would do with community organizations as she got the data, got some skills with different types of software and also process skills, various techniques. Well, COVID-19 really kind of put the damper on that, both the people that we would work with and also Shannon's ability. But Shannon will be doing her presentation in October. And so what I'm basically thinking about is moving forward and offering anybody on the call, and that's why I put my information here, an opportunity to get kind of a report tailored to your organization, your clientele, your mission of your organization. We've talked about things like food. Certainly we talked about transportation in the abstract that we looked at. Housing, poverty, education, the list kind of goes on and on. There are various things which are even more important now that COVID has happened. And so if anybody wants to contact me about the organizations that are represented on the call, it wouldn't happen by October 1. Shannon would shoot me, but this would be leading up to my abstract for trying to get an intern for next year. Usually you have to write your abstract in the fall. The students, the new medical students who are freshmen, look at what you've written and they decide, yeah, I'd like to work with Dr. D, or no, he's out there in the ozone layer, and they don't think much about that opportunity. But I had a lot of people that were interested in working with me last year and got sort of the cream of the crop, somebody that I had in a small group session. So in a long-winded way, that's the way I'd like to work with any of you, given that COVID hurt us. When you're given lemons, make lemonade out of it.
Thank you, Dr. DeLucia. Anybody else have updates? Lupe added some info in the chat box about Tennessee Voices, so make sure you take a look at that. One last thing that I will say is we hosted our annual Overdose Awareness Day event Monday night. And thank you to everyone who participated on that panel or who chimed in for the call. It was a really, just a really cool time to kind of hear some more stories and continue our conversation series that we've been doing. particularly focusing on substance abuse. Anybody that was on the call want to add anything to that?
No, just that everybody's valuable and that everybody deserves a life full of recovery. And that is my talking points for every training. But if anybody in your area needs Narcan, overdoses are up 30% in our area. We have fentanyl in Hawkins County. I could go on for days about the fake drugs that are out there. I'm getting ready to meet with the 3rd Drug Task Force to get them trained and get Narcan out to them. But if you need anything, any training, I can do it online and then get the Narcan to you, or we can do it socially distancing. I am very flexible. We can do it night, day, just not early morning. I am not a morning person. That would probably scare you. But I love each and every one of you and how you support Carter County, and love being a part of that. So if you need any help from me, please reach out. Also check with your local fire department. Make sure that they have updated Narcan. I've tried to reach everyone in your area, and also your EMTs if there are, volunteers or anyone out there like that needs Narcan, or your law enforcement. I've reached out, not heard a lot, but I think I've got the sheriff's department and the city police done. But if you hear of anything, please let me know. Thank you very much. Sorry.
Thank you, Sherry. Okay. Anybody else have any updates? Okay, well, I will share all of the info from the chat box and all of the things that we have talked about today in an email with you all soon, and we will see you next month. Thanks for being here.
Bye, everybody.